Riverside Pain Physicians.
Chronic pain affects an estimated 86 million American adults to some degree, and until recently, you might have to go to several doctors to get a correct diagnosis and treatment option. But at Riverside Pain Physicians, the doctors specialize in custom pain relief procedures. Their motto is relieve the pain, return to life. And Dr. Scott Kramarich is one of the physicians and joins us today with a new weekly segment. Thank you so much for being here, Dr. Kramarich.
Yeah, good morning.
Appreciate your time. Okay, so let's kind of start out with generic overview and exactly what is pain medicine? Who would come typically to see you and for what reason?
Pain medicine's been something that we've learned a lot about in the last 10, 20 years. We've got a whole new range of therapies that we can do that didn't exist. New medications specifically directed at nerve pain, bone pain, muscle pain, new technologies that we can use to specifically target that pain, like low-dose X-ray and ultrasound. So patients can come to see us if they're suffering with something that, hasn't been addressed properly up to now. A lot of times we can figure out exactly what's going on and target their therapies very specifically.
You know, my father, come to think of it, he has had shooting pain just down his leg, and he just, for years, and he's like, I'm so afraid to do anything about it. I haven't done anything about it, but he just endures and lives with his pain every day. Would he be the kind of candidate that would come to your office?
Yeah, he'd be a great one because he'd be so easy.
Really, I should tell him, because literally he's been putting himself through this because he's afraid of what, getting surgery or this sort of thing, but all he wants is just relief from his pain.
And that's the discussion we have with people all the time, is what can we do to avoid surgery, because people generally don't want surgery.
Sure.
or provide them with a good combination of medications, physical therapy, injections that we can do to target the pain specifically. So your dad has sciatica, and you've heard about epidural injections. That's probably what he needs.
So if someone is watching right now, I guess, what are some of the most common ailments that you see people coming to your office to seek help for, or does it just range the gamut?
You know, it really does. We see a lot of older people who have arthritic problems, deep aching low back pain when they stand for a long time. They tell me they can't stand at the sink to make a meal or do dishes. We hear that a lot this time of year. I'm worried about having the family come into town. I can't cook for them. My back hurts so much. Or the pain shooting down the leg. A lot of neck pain and headaches. People who've been in accidents or have been injured on the job. These are just perfect examples of people who come to see us, and it can be really pain anywhere. All joints, spine pain. Anything, and all the things I've mentioned.
And what is it like when these patients come in and they've been dealing with this agonizing pain, and then you provide them with relief? And something as simple as cooking dinner, or cooking Thanksgiving dinner, and they weren't able to do that, but then they can walk out of your office and are able to do stuff like this. It must be very rewarding for you.
It's terrific. Sometimes patients are mad because they've been struggling for so many years, and they just haven't found the right doctor who knew the right things or could do the right things for them to give them the relief. And so they have a combination of being happy and grateful, and yet wondering,
why didn't I do this?
Yeah, what took me so long to get here?
Why did I endure this? I'm sure my dad is thinking, as a matter of fact, I'm probably gonna have him call you because I've been dealing with this for so long because I was afraid of the options. I was afraid of doing surgery, but now there's something that you can do beyond that to help, ease.
Everybody has pain at some point in their lives. 80% of people. It's the most common presenting complaint at a family care doctor's office. And so many people have chronic pain problems that they're just not getting the treatment for that they could, they could benefit from. So.
And talk a little bit about your background, because this is something that you're extremely knowledgeable in, but also you're passionate about.
I'm an anesthesiologist, and so we've been doing spine injections and giving medications to people in the operating room for years to relieve painful situations, obviously. But now, as anesthesiologists, we've been able to transfer those skills to the outpatient world. And so people suffering with all these problems can get a lot of the same kind of injections and blocks and medications that we give in the operating room. We've transferred those skills to the home world as well. So it's kind of cool what we've been able to do in the last 10 or 20 years.
Was that one of your passions behind Riverside Pain Physicians and working and starting this?
Yeah, absolutely.
Yeah, and so if someone's watching, at what point in time should they come and see you? They're starting to notice some pain. Do they have to wait a certain amount of time? I know we just said that a lot of people are kicking themselves because they wish they had gone earlier to see you, but when is a good time to see if this pain goes away? Should you do that?
Everybody's going to tweak their back now and again. They do too much in the yard or play with the kids or whatever it may be. But if that pain goes on for more than a few weeks, or if it becomes debilitating to the point that you're not doing the things that you need to do at your job or in your home life, you're not able to enjoy your activities of daily living, you're taking too much of the over-the-counter pain medicines, then it may be time to see somebody, find out about getting x-rays, find out about having some, some minimally invasive procedures, or whatever we can do to maybe target that pain specifically and maybe make it go away.
Because I'm sure the prolonged taking of acetaminophen or these different pain medications that you get, Tylenol, Advil, what have you, I'm sure if you take that for a prolonged period of time, that can have some really adverse side effects on your body.
Right. I mean, a lot of people come to see me with stomach pain after they've been taking all those pain medications for so long, realizing they need another solution. They need to know what their diagnosis is and what can be done about it, rather than just hitting the over-the-counter meds so much.
All right. And what about coming in to see you? Kind of briefly walk us through the process. If someone wants to come in, what can they expect?
Well, first, and I think most importantly, they can expect to be seen by a physician, a fellowship-trained, board-certified physician in pain medicine. And so with an accurate diagnosis and an accurate, launch of therapies, we might have to find some things that work for that particular patient. And we provide them with a combination of things. It might be minimally invasive procedures. It might be adjustment of medications for bone and nerve and muscle pain. It might be physical therapy or some other things that we can do, to target those pain things specifically. Everybody has their own sort of treatment solution. It depends on what they want.
Yeah, and I'm sure a lot of people just want to be pain-free.
Right,
so.
they want the magical solution, which we can give them sometimes.
Yeah.
But it's a process that has to be worked through as well.
All right, Dr. Kramarich, thank you so much,
yeah,
sir.
Thank
Appreciate
you so
it.
much.
We appreciate seeing you. We'll see you again next week. And also thank you so much to Riverside Pain Physicians for coming on and sponsoring this segment. And for more information about pain management, their physicians and their locations, you can go to riversidepainphysicians.com, or you can call them 904-389-1010. Number right there on your screen.